This is Surya. This is Paramedicogenesis. Today we have to discuss about the pre-medication. What is the pre-medication? Pre-medication is the administration of the drug before induction of the anesthesia. So it will be produced smoother induction and to prevent the perioperative complications. So before start this video, let's intro. So pre-medication. Pre-medication is the drugs given before the induction of anesthesia. So already we know, so pre-medication will produce smoother induction of anesthesia and the prevent the perioperative complications. So we have to achieve the correct pre-medication. We achieve the 7A. So what is the 7A things are? Anxiety, anti-secretory, anti-emetic, aspiration prophylaxis, analgesia, amnesia, and last but not least, it's antibiotics. So we have to consider about the 7A. We have a better pre-medication. So first one is anxiety. Surgery is the stranger thing in patient's life. So it will be produce more anxiety in his patient. So to reduce the anxiety, we have to use benzodiazepine group of drugs like midazolam and diazepam. So midazolam and diazepam will produce the less anxiety. So better understand about the surgery. So second one is anti-secretory function. Secretion is the annoying thing during the intubation. To reduce the secretion will helps to better visualization in occulgodic structures. So intubation is very easy in decrease the secretion method. So to reduce the secretion, we have to use the anticholinergic group of drugs. It's also known as antixilocox. So glycopyrrolate is the first line drugs in anticholinergics. It's also reduce the secretion, and atropine is also used to in pediatric patients. So third one is anti-emetic. All anesthetic agents have a emetogenic property except propofol. So nitrous also have a emetogenic property. So postoperative nausea vomiting or nausea vomiting is the most common complication in perioperative period. So we have to use the anti-emetic drugs to reduce the nausea and vomiting. So commonly used drugs ondansetron, dexamethasone and granisetron. So ondansetron we know that serotonin 5-HT receptor antagonist, and dexamethasone have an anti-emetic property, and granisetron also used to produce the anti-emetic function. So fourth one is aspiration prophylaxis. Aspiration is the most dreadful complication in perioperative period. So to reduce the aspiration, we have to achieve three main things. First one is gastric volume, to reduce the gastric volume and increase the pH and increase the gastric motility. To achieve three things, we have to helpful in such a drugs like PPI, the proton pump inhibitor like pantoprazole, omeprazole, and H2 blocker, ranitidine, famotidine, and sodium citrate and metoclopramide also used to increase the pH and increase the gastric motility. So these drugs are helpful to aspiration prophylaxis. So fifth one is analgesia. So surgery is the painful procedure. So to reduce the pain will helps to better recovery in surgery. So to reduce the pain, we have to use the opioid and non-opioid drugs. So also known as NSAIDs. That means non-steroidal anti-inflammatory drugs. So commonly used opioids are fentanyl, fentazocine, and tramadol also used. And non-steroidal anti-inflammatory drugs also used. Some post-operative pain relief technique like ultrasound guided nerve blocks and epidural analgesia also used to reduce the pain in post-operative period. So is amnesia. Amnesia is the one of the trade of anesthesia. We know that trade of anesthesia as amnesia, analgesia, and immobility. So to produce the amnesia, we have to use it as benzodiazepines like midazolam. It's produced the anterograde amnesia. Anterograde amnesia means after administering the midazolam, we know about any recall the event during the surgery. And inhalation agents also used to produce amnesia. And last but not least, it's the antibiotics. Antibiotics will helps to reduce the surgical site infection. So we have to use it as 7A. 7A, we consider as 7A, we have a better in pre-medication. So we know that pre-medications will help to prevention of perioperative complication and smoothen induction of anesthesia. So Hope this video will very help to know about the pre-medications. We will see you next video as soon as possible. Until then, signing off, Jerry Ascon. This is Paramedico Genesis in English. Thank you.